Okay. Welcome everybody to the September School of Pharmacy Town Hall. Before we get started, I'll give you a few tips as usual. Your audio and video will be automatically muted. Only the panelists can unmute themselves. Please note that the chat function is disabled. If you have questions, please use the Q&A feature. As always, any questions that we're unable to answer during the town hall will be answered in email or, if anonymous, at the next town hall. And we'll hold all questions until the end. So as usual, I'm going to start with a little bit of data as it relates to coronavirus. There's a lot more to discuss as well, but just to center us on the statistics at the moment, and utilizing, again, the University of Washington database and predictor. At the moment, they give one of three potential predicted outcomes by January 1 in the way of deaths. If things continue as they are nationally, the estimate is that the deaths doing things the same way as we are now will be 408,000 deaths in the US. However, if people adhere to using masks when appropriate, that figure drops to 286,000. And if the mandates that currently exist are eased, actually that total goes all the way up to over 600,000. If you look at daily deaths, they do a similar sort of analysis, and that is at the moment, they predict that it'll be about 25 or 2,600 deaths per day by January 1. But if masks are used, that drops below 2,000. If the mandates are eased, that total goes up to over 12,000 deaths per day. In the case of California, at the same sort of analysis, if things continue as they currently are, they anticipate 50,000 deaths by January 1. However, if masks are adhered to, it drops to 32 or 33,000. But if the mandates are eased, it goes all the way up to 72,000. There is some good news. It's clear the cases per day in the San Francisco Bay Area have decreased from what was approximately 2,000 cases per day. And that was like late July, early August. And that is now to just slightly over 500 now. Similarly, deaths are decreasing from what was a peak of above 80 deaths per day in late August to now what is below 10. And just for the record, as of right now today, the number of cases in UCSF hospitals are down to 23, and it was up over 40 there for a while. But I will say it's not just coronavirus. We continue to have the racial injustice that exists in the United States and beyond. Global warming, the West on fire, it goes on. The only comment I would make here is please stay positive. This is not a time to be passive and to assume there's nothing you can do. Be an activist in any way you potentially can. One activist role would be November 3rd. Please vote, and please vote earlier rather than waiting until that day. There are a few campus updates that all relate to a lot of what's been going on with coronavirus and beyond. You probably know now that there is a UCSF COVID-19 relief program. The chancellor has announced this program for UCSF employees making $75,000 or less who are facing financial hardship during the pandemic, and a similar program is available to UCSF students seeking financial assistance. In discussion with Dan Lowenstein earlier this morning, we know there has been a lot of interest in taking advantage of these potential relief programs. In addition, the work from home guidance has been extended through June 30th of 2021. And they've extended this guidance for all employees who can perform their university duties remotely. They've also created by UCSF a toolkit that includes guidance for employees who are working remotely. And you can find that online at the coronavirus hot link at UCSF. I will remind everybody, as per the Office of the President once again, everybody is required to have a flu vaccination. UCSF will start providing influenza vaccines through campus flu shot clinics starting this particular week, with the hope that everybody is vaccinated by November 1st, once again in compliance with the Office of President's executive order. I've said this before and I'll say it again, these shots are particularly important to get this year to help reduce the anticipated burden on our healthcare providers and health system during what could be another exacerbation, not only of influenza, but COVID-19 as well. As a reminder, this vaccine is still required even if you're working from home and other remote locations. If it's more convenient to get the shot from a local provider near you, please do so. And that's probably enough from me. I want to kind of move into what is really our topical program today. And this relates to how coronavirus has just changed the landscape of how we do research. And to that end, I will be passing the baton to the Associate Dean for Research in the School of Pharmacy, Dr. Andrej Sali, who will host reports on this topic from a number of individuals that he will introduce to you. Andrej.
Thank you, Joe. Hi, everyone. So we thought that we'd have 3 slots, 4 minutes each, that will be divided between Kliment Verba with a little assist from Jacqueline Fabius. Klim is a fellow at the QBI Institute. Jacqueline is Chief Operating Officer there, the right hand of Neon Krogans. They'll be followed by Rosa Rodriguez from Clinical Pharmacy, and then Jaime Fraser will finish off that series. He's in BTS. In addition, Fran Aweeka will give some concluding comments, perhaps looking into the future, trying to encourage you to share your thoughts about maybe the bad aspects of doing research in the COVID area at the level of PIs, we felt, as opposed to students or postdocs or staff this time around. Just trying to encourage everyone to maybe come up with their concerns and plans to address them, thoughts about it, and maybe we will have more conversation along these lines in the future. So now, without any further interruption from me, let's have these presenters, Klim or Jacqueline.
Sure, 1 second. Let me share my... Okay. Can everyone see my screen?
Yes.
Okay.
So today we wanted to tell you about QCRG, the QBI Coronavirus Research Group. And the formation of the QCRG was really the understanding of the context of the coming pandemic and taking action. It was a rising opportunity to change how science can be done through extensive collaboration and lead to rapid advancements. 42 labs at UCSF came together to research COVID-19, each bringing their own expertise to address the problem. This meant that hundreds of scientists were working together over Zoom at this time, which became quickly unmanageable, and therefore quickly broke into subgroups, each of which with a focus. Kliment Verba, as Andrej mentioned, is a QBI fellow and one of the leaders of the structural biology subgroup, and he's going to tell you about their swift success.
Thanks, Jacqueline. Yes, and so, as a structural biology subgroup, our goal, the scientific goal, has been to really bring some sort of atomic level molecular understanding into the viral infection. And as a starting point for, on that journey, we use this, the protein-protein interaction map, which was the first paper which came out from QCRG, where all the host viral protein complexes have been identified, where, the virus infects the cells, and then it interacts with all those human proteins in our own cells to either hijack them or these proteins try to fight the virus. And so having this list is amazingly important as useful, but without having their molecular structures, without not understanding the exact atomic details of how these proteins come together, it makes it very difficult to design therapeutics, drugs, and understand the mechanism of how this works. And so the goal of our group, the broad goal of our group, is to really bring molecular details to these interactions. And, you know, many people all over the world, scientists really came together to produce a number of high-resolution structures of viral proteins. But many of the viral proteins by themselves are still not visualized. And furthermore, the complexes between the host and the viruses, most of them are in the dark, because to my knowledge, there's basically one structure between the host viral complex. One thing which was very apparent from the beginning is this is a huge effort where we're talking about 50, 60 structural targets. And so when Oren Rosenberg, a faculty here at UCSF, and I were tasked with leading this structural biology subgroup, it was clear that no single lab can really attack this. And so what we did is we went ahead and actually made a call to just the general structural biology community at UCSF, asking people who would, you know, in the trainees and the postdocs, anyone who wanted to join really, who would like to be part of this effort to structurally understand how this virus works. And what has been amazing is that over 60 volunteers who came up and said, yes, you know, I would like to help, be it a protein expression or purification or structural refinement, anything that as a scientist, you know, these are incredibly well-trained scientists and incredibly smart people, wanted to help and do this together. And what was really cool also about this is that they all came from many labs, many departments. It was really sort of across many buildings, even across UCSF effort. And this is the way the scientific meetings look like during the COVID-19 research. And so once we had this amazing group of individuals from all these labs, the next question was, how do we really organize this group so that we can work efficiently together? And what we came up with was really organizing it by functional subgroups. So this is probably much more akin to how one would do things in the industry rather than canonical academic approach, where we had a leadership group which would help us make more strategic sort of decisions of what to do. But then each of the other subgroups would be 10 to 20 trainees. Each subgroup would be tasked with a specific function, you know, expression, purification, different structural techniques or data processing. And each group would have a faculty leader who would oversee the overall process. And then also what we have is we have this team leader positions for the trainees, where they oversee, they help with the everyday process in the team. And also they get this incredibly important mentorship experience. And so this has been great, but the question is, does this work? And it does. So we started from zero in April, and here, this is not published yet, but this is something very exciting to us. We got this a couple of weeks ago. This is a structure of a human chaperone interacting with a viral protein, and in green is this chaperone. And in orange, this little helix with loops sticking out is a piece of a viral protein, which we basically pulled out from the protein-protein interaction map and followed up, and we were able to obtain the structure. And we can already see, but then come up with mechanisms of how it might be working based on the structure, and potentially the structure can now be used to develop therapeutics, etc. And this is just one of the success stories in the past couple of months. We are also in the right corner of the slide, you see we had a number of amazing collaborations with Ashish Manglik and Peter Walter's lab and Jim Wells's lab on nanobodies. We were able to quickly leverage this group of individuals to the expertise to really apply for grants, and got 3 grants to do this science. And more is coming. So I think this, you know, shows incredibly well what can be accomplished when a group of motivated, excited, and very competent people come together to do science together. And that's it.
Jacqueline, do you have more to say?
No, congratulations.
Okay, indeed. Rosa, would you go next, please?
Yes, of course. And thank you very much for the opportunity on behalf of the Medication Outcome Center team to share with you some of the preliminary data on a pharmacoeconomic study we are doing in COVID-19 patients. We follow an observational retrospective study design using EPIC, electronic medical record data, and following patients longitudinally. The primary study aim was to assess medication administrations during the hospitalization and related outcomes and treatment cost. And we included a cohort of COVID-19 patients and a comparison group of patients with human influenza diagnosis. The study included both population groups, pediatrics and adults, who tested positive for COVID-19, and as I mentioned, a matched cohort of influenza patients. Patients have to be at least 24 hours admitted at the UCSF Medical Center, and the first data pool that we have goes from March 1st through June 30th, 2020. Our primary study outcome was in hospital mortality rate, and in addition to that, we look into the length of stay, the ICU admission rate, ICU intensive care unit length of stay, drug utilization, and the treatment cost. Some of the preliminary findings in the 4 months of data that we have so far, there were 508 hospitalized patients, corresponding to 493 unique patients. So 508 encounters with 493 unique patients, meaning that we have patients that were hospitalized more than once during the 4 months study period. Of them, 7.9% were children. And among these patients, 64%, almost 2/3 of the patients were male, of the COVID-19 patients were male, compared to 45% of the influenza patients who were male. To the Dean point before, we observed that 35% of the COVID-19 patients were white, while 90% of them were Black or African Americans. So in other words, the incidence of the COVID-19 disease impacted, it was 2 times greater among the African American community than the white patients. The mortality rate was 3.7% among COVID-19 patients, compared to 1.3% among influenza patients. All were adults. The average length of stay at the UCSF Medical Center was 10 days, over 10 days for COVID-19 patients, compared to 3 days for influenza patients. And the difference in the length of stay and intensive care unit admission rate between the 2 groups, the COVID-19 and the influenza patients, was also statistically significant. What we have observed is that in the preliminary data is that hospitalized COVID-19 patients use a wide spectrum of pharmaceuticals, including inhalers, bronchodilators, antivirals, antibiotics, neuromuscular blocking agents, sedating medications, opioid anesthetics. So the preliminary evidence shows that COVID-19 hospitalized patients may go under a lot of significant clinical and economic implications, not only for the patients, but the families, and certainly UC Health Enterprise. We recognize and are very grateful to the large effort and underway efforts, both at the institution and certainly the school, and we're very grateful to the department support to grant us access to this data. Some of the challenges that we encounter and some of the opportunities that we see moving forward relates to common challenges working with big data, such as timely access to patient-level outcomes data, Data missiness is another challenge, and the lack of comprehensive economic data. Thank you.
Thank you very much. Jamie, you're next.
Hi, so I'm gonna update on a charge that Andre asked me to, which is, how is COVID and the work from home period affecting the way we do research? Not so much my research program, because I'm involved in the effort that Klim outlined. I think that's been super important and energizing. But it's really, changed a lot of the questioning that I do for myself about how I run my research group and how we should be running research groups. Running a research lab is kind of a weird thing. I think the closest analogy is that it's kind of like running a franchise of a fast food restaurant. We have a shared infrastructure, but each lab operates relatively independently as far as budget and personnel. And that, is wonderful because there are many different styles that can evolve through that, but it's also really hard when we need to communicate things like a lab shutdown and different policies. And then when you add on top of that, on top of the pandemic, the ongoing crisis in sort of racial justice that we're having in this country, it's been a really challenging time to think about how this is affecting researchers, or the process of research, and how work and the ability to work is being distributed. So, we're thinking a lot about what are the strategies that will enable us to lead our groups effectively in an equitable manner and in a transparent manner. And that transparency sort of needs to go through all levels, from above the individual lab level all the way through the lab. And so I've been trying to think about that question and a lot about what will we do differently next time. And I don't know that there are that many concrete things that we could do differently next time, other than an increased focus on transparency. There are no easy answers and there are no quick fixes. So, as we've been reopening, how has the communication gone? Should it be going through departments, graduate programs, the lab neighborhoods, through the School of Pharmacy, School of Medicine? It's been really confusing and it's been unclear for us sort of what truth is and what's coming, even though I know people have been working hard on trying to communicate transparently. Then once we started running our groups, how do we allocate time in lab? We're trying to work safely at lower capacity. How does that work with training people when you might need to be in close contact? This is uncharted territory. We don't know what we're doing yet, and we're trying to figure it out. And how do we find ways to share what's working between different labs? What is this going to mean to outside evaluators? That's a question that's bothering us. We're already seeing disparities by gender or caregiver status, and this is putting people in an impossible situation of choosing between safety and going into lab and being productive. Moreover, how do we accommodate caregiver responsibilities at all? There's no school. I've felt this myself. I have young kids. They're now back in UCSF daycare. Do I feel like that daycare is safe? I don't know. There are YMCA learning camps being run. Are they safe? We don't know. I think that every effort is being taken, but it's really hard. And just because people are sending their kids to these situations doesn't mean that you feel completely comfortable doing it. And that's a really hard position. How do we give space to people in our labs to grapple with societal unrest, racial inequality, the mental health strain of the fact that nearly 200,000 people are dead? We got to listen to the people in our lab. I'd like to give a special shout out to folks in my lab who teach me a lot. But I think lab leaders also need to take responsibility for leading these conversations and for their own self-education. So now I feel like we're in this next phase, but why are we in a next phase? Nothing has changed. Everyone is just restless and the sky is freaking orange. How are we going to increase capacity even more? And how are we going to do it safely? I don't know. I don't understand where we are on testing or communication of policies. I'd like to see a lot more transparency on that end. And I know that people are working hard on it already. So to those people who are working hard on it, thank you. Thank you to the staff who are keeping things running in labs, the custodial and security staff. Thanks to everyone who's working so hard keeping departments and schools afloat from home. We appreciate you. And I know many people are having a tough time. I'm having a tough time too, and it's great to gain strength in a community like this. Thanks.
Thank you, Jaime. Thanks a lot. And I am guessing this is going to transition reasonably nicely to Fran's comments. Fran?
Sure. Thank you, Andre. Yeah, there'll be a little bit of overlap with the points James made, but maybe I'll be posing a few questions. You know, I thought that after hearing the inspirational science talks by Klim and by Rosa, and then I don't know if you had a chance to listen to Ashish earlier today at the School of Medicine Grand Rounds, but it was outstanding. I don't know, Ashish, if you're on, but in the Q&A with Dr. Wachter was, I think, particularly strong. So we're really proud of all the science going on in the school. But I thought maybe I could just start by giving a little bit more of an update of research in the Department of Clinical Pharmacy. I mean, I think what's true for all the departments is that, you know, established work is steadily moving forward at perhaps a slower pace. I know that our main laboratory is almost at full speed, and our clinical trials nationally and internationally are starting to recruit. I know internationally we're pretty active in Africa. Nationally, the essential trials are moving forward. The non-essential trials actually are having some challenges. So things are not quite revved up, but again, established work is moving forward. There have been, you know, generally established funding, I think, looks pretty good. There's been a few issues that have been brought to light in terms of one 5-year grant that was doing great for 2 years, and then there was some issues with the 3rd-year funding, which hopefully have resolved, and then a particular grant where it was really borderline a new grant. And I think before COVID, we feel very strongly it would have been funded, but because of COVID, we're blaming it on COVID anyway, that it didn't quite get funded. So funding is generally okay for established work, but for new work, we're concerned. But I wanted to follow up on what Andre said I would say, and then a bit of what James was saying. And that is to try to initiate some discussion, hopefully here and maybe in a future town hall, on how COVID has impacted how we do research, like James was saying, and then but then also our satisfaction with our work, which also was alluded to. And, you know, to state the obvious, if I may, for a moment, I think we all agree that Zoom discussions, meetings, our teaching, I mean, it's really quite effective. I don't know what we would do if Zoom didn't exist. I think we all feel we've been relatively productive that way. However, at least from my perspective, it's the in-person interactions that we have really always found so stimulating and has made work fun that obviously are on hold. It's the inspiring in-person seminars and the face-to-face research and committee meetings where ideas can be more casually shared and new ideas can be more naturally generated. I mean, all those things are definitely being stifled by what's going on right now. And so, not to state again too much the obvious, James already pretty much has stated it, you know, is this truly compromising our scientific progress? Is it compromising our motivation as faculty, as students, as staff? And I would say it is. And what can we possibly do about it at this time? So, but in addition, as James also alluded to, it's the inability to separate home from work. I don't know about the rest of you, but that was always really important for many of us, certainly important for me, especially those of us that have school-age children at home, but for anybody, being able to separate home from work is part of what makes work fun. And then you come home and you have fun at home. And now it's kind of all blended together, and this brings a lot of distractions to our ability to get our work done and to be really present for our work. So anyway, I'll leave it at that. We're interested in knowing what you think, how it's impacting science and work satisfaction, and how we might possibly be able to address it. I thought this great idea. I was at Mission Bay on Tuesday. I thought, oh, look at all this space. But then I listened to Monica, Dr. Rutherford, and then Joe. And of course, I think our ability to actually resume in-person sessions, even if masked and even if small, may be somewhat limited. But is there something we can do to try to first of all, we need to recognize this is going on, but then how can we probably address it? So anyway, I'll leave it at that. I'll turn it back over to you, Andrej. Thank you.
I'll just quickly say thank you so much to everyone for their comments. Maybe the only other thing I'll say is that everyone was explicitly asked to please bring up any research problems, any group leadership problems, any institutional problems, as much as they could. Problems, things that we could improve. And you saw what the presentations were. There were not that many problems, despite the invitation. And so I would almost take that partly as a positive sign, partly as a sign of people perhaps having to be encouraged to speak up sooner rather than later. So please don't inhibit yourselves, PIs, if you have issues. Maybe systematically transmit them to your chairs or to the dean or even to me, and we can then talk about them and try and do something about them, especially if they seem to be at the level of the School of Pharmacy as opposed to the planet or the country as a whole. Thank you. Probably Joe, you want to say something?
Well, thank you, Andrej, and thank you, Klim, Jacqueline, Rosa, Fran, Jamie. I appreciate the comments. It was really fantastic. And I do think there's a lot of opportunity to expand on what we have discussed and to get into a great deal of more depth. With that, we are a little bit past the hour. And so as always, I will close saying, please take care of yourselves, particularly during these times. It just seems like it's compounding one thing after another. Do your best not to let it happen to you. Be activists. And I'll repeat, November 3rd is coming. Please vote. Until next time, please enjoy the rest of your afternoon, and thank you all for this participation.
Thank you.
Bye, everyone.
Thank you. Bye.
Thank you.